Hello guys, welcome to Medical Hotspot. Today we're gonna to discuss about pharmacology, a little bit on cardiac electrophysiology. So contents: introduction, impulse generation, conduction, excitability, and a refractory period. Let's move on with introduction. Drugs having their major action on heart or blood vessels or those used primarily for serious disorders are known as cardiovascular drugs. They can act directly through autonomic or central nervous system. Okay, let's discuss about impulse generation. Electrophysiologically, impulse generation can be distinguished into two. One is non-automatic fibers and automatic fibers based on myocardial fibers. Okay, there is a there is a diagram. You can have a look. That is the diagram about the diagram of transmembrane potential of automatic, which denoted in red, and non-automatic, which denoted as purple. So you can have a look. Okay, let's move on to non-automatic fibers. They cannot generate impulse on their own. During diastole, the resting membrane potential remains same. So when stimulated, they depolarize very rapidly and rapid return to phase 1. During phase 2, plateau phase, Ca2 plus ions flow in and bring about contraction, which leads to rapid depolarization. During phase 3, sodium ions and potassium ions pump gets activated. During phase 4, resting membrane potential is attained and does not decay. So next one we can see about automatic fibers. These are present in SA node and AV node. The most characteristic feature of these fibers in phase 4 are slow diastolic depolarization. The rate of impulse generation by a particular fiber depends on the value of maximal diastolic potential and slope of phase 4 depolarization and the value of threshold potential. Okay, you can have a look of fast channel action potential in Purkinje and the slow channel action potential in SA node fibers. And you can see in the diagram graph that threshold value has been marked both for fast and slow channel APs. Okay, now we can discuss about the slow channel and fast channel action potentials characteristics. Site of occurrence in fast channel, it's on atria, ventricle, and Purkinje fibers, and in slow channel at SA, AV, and AV rings and coronary sinuses openings. So next is predominant ion moving in zero phase. Sodium in fast channel because it moves very fast, and calcium is slow in slow channel. So activation and inactivation kinetics: fast in fast channel as the name denotes, and slow in slow channel. So channel reactivation: voltage dependent on fast channel and time dependent on slow channel. Activation potential rate, which is nothing, threshold voltage is -60 to -70 MV in fast channel and -45 to 55 in MV in slow channel. Conduction velocity 0.25 meters per second, but it's quite slow in 0.01 to 0.1 meter per second in slow channel. Conduction velocity. Okay, so next is ERD or EAPD. ERD is nothing, effective refractory period, and EAPD is action potential duration. Always remember, ERP is less in fast channel and ERP is more in slow channel compared to EAPD, action potential duration. Next is selective channel blocker. So tetrodotoxin and local anesthetics in fast channel, and verapamil and diltiazem and manganese ions in slow channel. Okay, next is conduction. It's very important it's a very important part, because the conduction should be very regular and it should be very synchronized. Okay, first, the rate of conduction through a fiber is a function of its membrane responsiveness. So how the conduction depends on the connection between the one cell and the other cell. So the boundary should be vary the boundaries of the cells. So The rate of conduction through a fiber is a function of its membrane response, how the membrane of the next one is responding. So next one is in the sense the adjacent cells is responding. This type of relationship is seen in atrial and ventricular and Purkinje fibers. A drug which reduces the slope of zero phase will shift the membrane responsiveness curve to the right and impede conduction. Okay, a reverse occurs with a drug that shifts the curve towards the left. Okay, next one. Small cells at the upper margin of the AV node have very low conduction velocity. This is very frequent. One mark which is frequently asked in university exams. Normal Purkinje fibers have the highest conduction velocity except near the junctions with ventricular fibers, or if they change over from fast channel to slow channel response. Okay, next, excitability. Okay, this property of a fiber is defined by the strength of stimulus required to elicit a response or to produce an AP, action potential. Hyperpolarization decreases excitability, whereas a small reduction in resting membrane potential increases excitability by respectively increasing or decreasing. Okay, however, when the RMP is reduced to a value below the threshold potential, the fiber becomes inexcitable. So we need at least a threshold value to make a fiber excite. Okay, refractory period. The effective refractory period, which is the minimum interval between two propagating APs. It is closely related to the AP duration. AP can be evoked in fast channel fibers even before completion of repolarization. Most anti-arrhythmic drugs increases ERP per ERPs to APD ratio. Okay. Okay. We can discuss about the effect of stimulation between parasympathetic and sympathetic. Okay, so first is atomicity. In SA node it's bradycardia, and in sympathetic it is, so about SA node, in parasympathetic it is bradycardia, and in sympathetic it is tachycardia. So ectopic ventricular, there's nothing in parasympathetic, and in sympathetic it has been enhanced. So about refractory period is in atria shortened. Even in sympathetic and parasympathetic, the atria has been shortened, whereas in conductive tissue it has been prolonged in parasympathetic compared to sympathetic. Okay, next, conductivity is decreased in parasympathetic and enhanced in sympathetic. Contractility is opposite to what we saw in conductivity. It has been decreased in parasympathetic and increased in sympathetic. That's all, guys. So if you gained anything, if the video is useful, then please like, share and subscribe to our channel Medical Hotspot. Stay tuned for the next video. Thank you, guys. Bye bye.